Hi, I'm Toni Wolf, and I'm the Executive Director of Employment Options, and I'm really fortunate to have Evan Kaplan here from Philadelphia. And we've had the pleasure of Evan and I of talking about families. And so, can you talk a little bit about how you describe family recovery?
Sure. Family recovery is, in terms of mental health, it's about having a conversation and being open about who we are in a way that builds trust and promotes childhood resiliency, as opposed to the silence about mental illness as a topic that nobody's really very comfortable with.
Correct. So what's the impact for your own children that you've been able to talk about mental health? Your own mental health issues?
Yeah. So Charlotte and I, my daughter, were really kind of estranged for a number of years. I had been through some difficult times with my own mental health, and a wall had really grown between the two of us. And it was a wall filled with misinformation and discomfort, and on Charlotte's part, a lot of anger. And so when I found out that my silence was actually contributing to breaking down our relationship, I realized that we needed to start talking about what was really in front of us, the elephant in the room. And that process was a bonding experience, it was a learning experience, and ultimately it was a healing experience.
So you talk about your role as a parent, but I certainly, from my own experience, know how hard it is for the system to think about people as parents.
Sure.
As being a caregiver instead of always taking from services. So can you talk a little bit about your experience around that?
Sure. So my experience has been that few providers are asking questions around family. And I think our system is not set up to allow them to do that. But there's an education component too, and a comfort component. And I think we need to reframe the way we look at mental health as a family issue, and we need to start asking very different questions. And the first question that doesn't get asked very often is, are you a parent, or do you have a family? I see myself first and foremost as a parent, and if you don't ask me that question, I feel that you're not seeing me as a whole person.
And I certainly know in working with families, parents will say, it is because of my children that I'm doing this. It's because of my children that I'm going to treatment. It's because of my children that I'm really doing everything I can for myself and my health so I can be a better parent.
Yeah, absolutely.
So it's an incredible motivator, and yet the system somehow has ignored that role.
In fact, we probably tamp it down a little bit by ignoring it. So, you know, healthcare providers, service providers really should start thinking about the questions that they can ask that can draw out information about what people's priorities are. And family is a priority for most of us. The bigger impact is that our communities are really family-based. And if we start healing our families, our communities start to heal as well.
So we've been using 3 words. Reframe, so we want people to really reframe the way they're thinking about things. And ultimately respect the role of families and respect the parent role.
Right, right. If I'm struggling as a person with a mental health challenge, I rest assured my family is struggling in some way as well. So rather than look at just the diagnosis of the individual, we should be looking at the health of the family. And what can we do to help support that family, be it, you know, social supports or natural supports. It's not just about medication and prescriptions.
So the system needs to invest. Can you talk a little bit about that? Because you and I feel pretty strong about that.
Sure. Yeah. As a grant-funded organization, I know how hard it is to find funding to support these kinds of programs. But it does take money, and we should be talking to policymakers and the people that are writing the checks about investing in our families. It's not just about investing in mental health. It's investing in our families. And when we invest in our families, we're investing in the community and the larger organization.
So for some people that means very specific service delivery. For some people it might mean education. So it really means really looking at and having an environmental scan in the system to see where are the gaps and how are we going to start addressing this issue. And I think both Evan and I feel really strong that it's time to really change the paradigm and start asking how many parents are in the mental health system and what are we going to do about that so that they can be good parents.
Yeah, and we want to be.